Today was my 1 week post-op surgery appointment, and I want to take a minute to, catch up with everyone and blog, and then, tell you guys my experience up to now. Again, this is for a full patellar tendon tear, and I had surgery last Tuesday, and today is Wednesday of the following week. So the last one kind of just was my post-op day after appointment. So this will be kind of what happened from the last video up to, today's appointment that I had. I'm trying to break it up in a few different things. One, let's talk about my experience from day after surgery till now. Understand though that my experience could be completely different from yours. It's just my take. My opinions, my tips, if you take them. All right, so last time we talked about like how I was feeling, medications I was taking. So that Wednesday, I was obviously taking medication still. I was taking Oxy once a day, about every 4 to 5 hours. I was kind of spreading it out. I was about every 5 hours. I knew that my block that they put in my leg came out later on day after surgery, my post-op day after. The block wore off, and you can absolutely tell. And once I noticed that, I got a measure of how much pain I was feeling on meds. And then once I was taking my meds and I started feeling no pain during that entire gap, then I weaned myself completely off pain meds. I will tell you that for me, I was on pain meds day surgery Tuesday, all day Wednesday. Wednesday is when I started feeling a little bit of uncomfortableness, but not pain. And then Thursday. So 3 days total: surgery day, post-op surgery day, and then the day after. But by that evening, I was feeling no pain, no crippling, uncomfortable pain. You still feel your knee, especially for me. I still felt like my knee. I still felt like the staples. I still felt the pressure on my kneecap as I was moving around in my brace. But I wasn't feeling anything that was crippling enough that I felt like I needed medication. I never had to take any of my nausea medication. I never felt nausea at any point in time. I have been taking the aspirin that I was prescribed. Aspirin was every single day. I'm still on that. I'll still be on that until, they tell me to stop taking it. As far as mobility. So this is a difficult one for me because I have 2 little girls that are 3 years old, a wife, 2 dogs. I would say that my life was busy before. I wasn't crazy active. I won't exaggerate and tell you like I was at the gym every day. I was running, 5 miles a day. I was busy. I work from home, but I was constantly like up grabbing something, up, outside with my dogs, just sitting out there, or running around with my kids, or just moving back and forth through the house, or, around my neighborhood. The brace will enable you, right? The brace will give you power and make you think that you can do a lot of things. You'll feel almost like, oh, I can walk without my crutches. Don't go crazy, right? Because there was one day and I felt really good. I felt strong in the brace. I thought, like, in my head, I told my knees repaired, right? And I was walking around and I think I took a step wrong and I felt myself losing balance, right? So that's when I knew to like reel it back in, right? Reel it back in, sit down, and take time. I will say that, mobility is definitely a problem, because my biggest struggle is carrying stuff. So with my 2 crutches and trying to brace my leg and give my leg adequate support, what I find is I can't grab simple things like my cup of coffee or a plate and move it from, kitchen to living room, or from kitchen to table, or from something to my office when I'm trying to do like some work. I find that incredibly difficult. So if you have support, if you have family, if you have a friend, this is a good time to either stay with them, have somebody stay with you, or I don't know. But you definitely need like assistance. Not assistance with everything, but definitely you need assistance. You need help to do things that you may feel incredibly independent about. And I would say like that's been the most humbling part about all of this, is having someone have to bring me the simplest of things, things that I just randomly forget. I moved all the way to the office. I got my leg up. I'm in my desk chair that's stuck and I'm working. Forgot a spoon, right? It's going to take me, 6 minutes to pull myself out and go back and get that spoon versus, having my wife, who's fortunately available, to go grab the spoon or something. And this is going to get a little wild. Pooping. And pooping is a problem, right? It is a serious problem. Sitting down on that toilet with your legs straight is the single most uncomfortable thing that I think I've ever done. It is unnatural for my body to have my leg straight while I'm sitting on the toilet. Is it doable? Yes. Is it uncomfortable? Absolutely. It is uncomfortable, but it is doable. I can tell you that those little propped up potty machine or potty attachments and crap like that, like I looked at one, I had one on my toilet. It was not for me. Another thing that's super uncomfortable for me is elevating my leg, right? I've noticed that like when trying to keep my leg elevated or on something, the positioning is key, because what happens for me is that my leg will sit there and initially it feels really comfortable, but in a few minutes, it's terrible. In a few minutes, it's terrible. My whole leg's gone numb, toes are tingling, all of that. So that's super uncomfortable. But outside of those things, for the most part, you start to feel better. After 1 week, I feel no pain. I feel spasms in my leg from time to time. I can feel my staples and they not hurt. So when I'm cleaning, I can really like get around those staples, make sure there's nothing there, because I don't feel any of the pain. Before, I couldn't feel my tibia, my bone below my knee at all. That feeling has come back. There was some itchiness, right? Like when I started getting feeling back, I started getting like itchy. But I resisted like having to scratch myself over and over and over again. But that goes away, for me at least, not too long after you start feeling it. I've gotten almost all feeling back in my leg with the exception of 2 small spots. Imagine this circle being my kneecap and this being the side of my leg. On the side of my leg, on both sides of that kneecap, are the 2 main spots that I haven't gotten full feeling back yet. But I can tell you're touching me, but it's not the full feeling. Outside of that, everything else is returned kind of as normal. I had a follow-up today. We talked about, just that the wound looks great. The incision looks good. It seems to be healing just fine. We're hoping next week's appointment we'll be taking the staples out, and then I'll be on to road to recovery. A few things that I'm still doing is taking my foot and extending it in and out the way they asked me to do. I haven't done any quad muscle pulls. I know there's stuff out there that says, tighten your quads over and over again, but none of my docs have said do that, so I haven't done it. And logically, for me, it makes sense as to why I'm not supposed to do it. Okay, so life, right? Life is difficult. You have to understand your limitations. I have 2 3-year-old girls, twins, and they run around this house like crazy when they're here. And as much as I enjoyed running around with them and playing, you just can't. You can't do it, right? So you have to find other ways to have fun with your family or spend time with your kids or any of that stuff. We used to do bedtime routine upstairs every single night. We've had to move bedtime routine downstairs because I can't go up the stairs. Well, I can't get back down. So you have to change certain things in your life to to help you stay mentally strong during this, right? And that was kind of one of the adjustments that we made. Cooking is doable. It's difficult, but it's doable. The biggest problem with cooking is getting things from one spot to another, trying to carry while also trying to, aid yourself or keep yourself propped up with your crutches. A few things or techniques that I've done is, since my leg is in the brace, it's in a hard stationary position, so I can almost do a wide leg stance, and I can stretch across my kitchen and grab certain things and move them to one area and then work that way whenever I need to cook. But it is difficult. It will take you a little bit longer. So if you're the only one cooking in your family, adequately prepare more time to make that. When I got cleared post-op, they told me I was also able to shower. Showering brings you back down to reality because you take your brace off. Your brace shouldn't get wet. So when you shower, typically your brace comes off. When your brace comes off, your leg is flimsy, your leg is dull, it's not as strong as you remember. You have that that sense, that urge to move your leg the same way you have been when the brace is in, but your leg doesn't move that way anymore. So it's very humbling when you shower. It tells you that you're not there yet, but it takes a little navigating. A few tricks that I've done with my showering is, so I turn my shower on, I get my water warm, and then I turn my shower off. I fortunately have like a bench in my shower that I can sit on. So if you don't, I strongly recommend you buy one of those chairs that you can sit in your shower. If your shower is not long enough to stick that chair and sit down in that chair with your legs straight, then you may have to look at like some different options as far as how to shower efficiently. I can't tell you how to make that work. But if you have those two options where you can sit, then you turn your shower off, get in, sit down, take your brace off while you're sitting, and then you can stick your brace on the outside of your shower, or you can have someone help you if you're married or have a significant other, have them take your brace, stick it on the outside of the shower, and then turn your shower back on. The water should still be warm. You can use that method to like wash yourself down while you're sitting without actually affecting your leg, putting pressure on your leg, accidentally thinking to bend your leg or any of that. Once you get to that point and you finish showering, if you're like me, you have a sealed bandage kind of on your knee, and I normally shower, then peel that sealed bandage off, and while I'm still in the shower, I will alcohol and clean that bandage up. After I dry off, I just dry my leg first. I then alcohol and clean that bandage up, seal it back on. I grab my brace, because the only thing I've worked on so far is my leg. I dry my leg, clean my leg, put my brace back on, and then I dry the rest of my body. That's been the best method for me to like save time. And sometimes it's a lot easier for me if I have to do it by myself because my wife is unavailable with kids or anything like that. That's been an easy method. Nothing critical has happened to my leg thus far. So little tip there. There's a question you got about 1 week post-op, let me know and I can try to answer it as best I can. I'll probably be posting all of these videos kind of clumped up right together because I haven't posted anything yet, but I have 3 weeks worth of videos. So you may be seeing this, you may see me in the same outfit, I don't know. I am still using this band to help like aid my leg in certain positions, especially when I'm alone. I highly recommend just grabbing one of these. I don't know how much they cost, but they can't be too much. If you can grab you one, trust me, it will help you tremendously. And I don't care what anybody says, I assure you it will help you tremendously, just like helping get your leg on your bed, on your couch, on a desk, or on anything. I am buying a elevation pillow because, like I said, elevating my leg hurts me over a course of time. So I'm buying one of those, so I'll be able to tell you a little bit about one once I have one, if it's worth an investment or not during this whole recovery process. I don't know. I'll let you know probably in the next video how that's going. Until then, later, good luck in your recovery.